What is up? If you are dealing with sciatica or you're not sure if you're dealing with sciatica, then this is the video for you. I'm going to go through three things that you need to know about sciatica. Make sure to stick around till the end because each of these three things play off of each other. It's important to know each one. I also have a question for you towards the end that I'd like to hear from you. If you are new to this channel, I am Dr. Nate. I'm a physical therapist, and this is my business catalyst. And I created this channel to help people overcome pain, understand it, to live well, and to just get strong, because getting strong is my favorite thing. So let's jump right in. Make sure to like and subscribe if you haven't already. You can, I think it's over here, or maybe it's over there. I don't know, it's somewhere. So just hit those buttons, smash them, click them, whatever, tap them, and we'll get to it. Number one, symptoms. So it can be shocking, jolting, like, it doesn't feel good. And what these symptoms consist of, typically it's pain that originates in the back and then travels down to the glutes, all the way down the back of the leg, and can even go down to the heel and the foot. Sometimes it'll be going down the front of the leg. This is more of like a femoral nerve distribution, femoral, femur, leg, leg bone. And can also be going down the middle of the leg, so more of like an obturator. It's called the obturator nerve that can be causing that. So there are various different types of sciatica. The technical term is radiculopathy. So there's those three things, and then also it can be characterized by some numbness, tingling as well, kind of pins and needles feeling, really uncomfortable. So those are really the symptoms of sciatic nerve pain. Number two, I want to talk about the causes of this. So a lot of people, if you type in like pinched nerve on YouTube or on Google, you get a lot of different results. The idea is that, you know, there's nerve roots, and these nerve roots, they exit from the spinal cord and they go through, they go and exit through different spinal levels. And the idea is that something gets pinched. Now, maybe like there might be some truth to that, but we know that there's some sort of nerve irritation. Maybe it's being pinched, maybe it's not. We don't really know for certain. Some people it is, some people it's not. So that narrowing of openings between the different spinal levels can often lead to that. There's also something called spinal stenosis, which is a narrowing of the spinal canal at different levels, and that can be either through the little holes, which are called the foramen or foramina, and then there's the spinal canal itself, which can get narrower. So there's those two things, and there's a disc issue, so like a herniated disc or a bulging disc, which can put more pressure onto nerve roots and cause pain that goes down the leg. So that's also something that can happen. Those are all different potential contributing factors to having sciatica-like symptoms. But the most important part is, what can you do about it? So it's great all these videos exist of like, well, what is it? That's awesome, but then everybody leaves thinking that they need to get surgeries or injections and all this type of stuff. And that couldn't be farther from the truth. Like, I have worked with dozens of people with sciatic symptoms who have improved and done just fine. I've worked with people who have had like big herniated discs, and they went through a course of rehab and they were good. Their body was able to heal itself. And so I'm going to share with you a couple things that you can do to help yourself. So I have a ton of different videos that I've made, and I'll put some of them, they're going to be up here, maybe up here. I'm going to put them around on the screen so that you can click on those, and I have more specific instructions on it. But the short and sweet version is that if you do specific exercises, if you generally get stronger and you do some aerobic exercise like walking, swimming, cycling, and then some weight training and different like specific exercises in addition to that, and you give it time, then likely your symptoms are going to improve. Likely. Now, some people do end up needing a surgical procedure or some sort of injection, but that should be the last option. That's not option number one, that's option number like 20,000 in most cases. Now, if there's worsening numbness, tingling, weakness, and loss or difficulty going to the bathroom, like number one and number two, that's a different story. If you're dealing with those issues, then you need to go see your doctor ASAP, because that could be not life-threatening, but it could cause some really bad things to happen. So most people aren't experiencing that, but there's a lot that you can do. It doesn't. I know it's frustrating. I know that it hurts a lot. And honestly, like, a lot of people develop this from, they don't even remember what happened. There wasn't like a specific event that caused it to happen, unless there's some sort of like disc herniation that people experienced and there was some traumatic event. But in most cases, like, people come in, they're like, I don't even know how this started. I don't even know why this is happening. Typically, people are more sedentary who experience this, so they don't move around quite as much, they're not exercising as much. So getting back into an exercise routine that doesn't make symptoms worse, that either keeps it the same or makes it a little bit better when you do it, that's the golden ticket. And then giving it time. So when I say time, how much time? Everybody's a little bit different. So some people will improve in a week, some people will improve over the course of 3 months, or a little bit longer. It's all different. So you can't gauge your success or your recovery based on somebody else's recovery, because it's all different. But I can say, not for certain, but with a high level of confidence, that if people do specific exercises that help either reduce some of the discomfort and don't make it worse, start doing more general conditioning, walking, swimming, biking, lifting weights that doesn't make symptoms worse, will probably make it better, and give it time and have an understanding that things will get better, like, you're going to be on a good road to recovery. So again, go ahead and check out some of my other videos that I have put out on this. It'll help give you a better understanding. And in the comments below, I'd love to hear what you've done for sciatica and what other topics you would like me to cover, and I'll make videos about that. So please hit the like button, subscribe, press that button if you'd like to see more videos from yours truly. And until next time, I'll catch you later.